Hello, I'm Craig Stern of Pharma Pharmaceutical Consultants. We've been talking about various issues with regard to pharmacy benefits, and our audience, of course, is human resource individuals, plan administrators, etc. I want to talk today about this whole issue of quality, value, what you expect to see with regard to outcomes, and especially when you deal with it with regard to pharmacy benefits. The real question that we have here is the following. What's quality? What's value? Cost, of course, you can quantify, so you know whether something is expensive or not expensive, and that's pretty direct. And that's probably part of the problem, that you can quantify money relatively easily, but when you get into quality and you talk about value, you have a problem. If we're going to talk about it, we have to have some idea of what's included. Now, some people give some very simplistic kind of equations to say what they think value is and figure that it has something to do with quality and cost, and that these parameters are all fit together. And in general, that's true, but in general, it is also too simplistic. The real issue that we have to address is that if we're going to pay for something, for every dollar that we pay, there should be some value that we receive from that. Some return on investment. So if we're going to deal with that, we have to be able to get an idea of what the numbers are. Now, there's a bunch of different ways that pharmacoeconomists use in order to identify quality adjusted life years and a whole bunch of other things. And the good news is that they have something, and clearly it's something that can be quantified. The bad news about it is that it's hard to understand. It doesn't have an intuitive feel to it. So when I or other people try and explain it to people, it's hard for them to pick up what we're talking about. So let me try and take this from another tack. The other tack I'd like to take is the following. On one level, if you give drugs, you'd like to make sure that the outcome that you expect actually happens. So there's a clinical impact that you expect, for example, if you give a drug for high blood pressure, that in fact it's going to lower your blood pressure. Number two is that there are intangible issues that are also included. For example, if you can't get to the doctor that you want, that's an access problem, and as a result of that, patients will tend to think, and so will professionals tend to think, that access problem compounds the issue, and effectively through access and the lack of access, therefore we have a problem with quality. Furthermore, on top of that, if we have difficulty in getting the medication, like for example, there's been a big shortage in a lot of the cancer chemotherapy medications over the last several months, that's an access issue. Clearly, there are drugs that you want that are going to help you to get the outcome that you want, to get the hopefully the life-saving benefit that you want. That's immediately a quality problem. It's not easy to quantify, but clearly has a major impact in what goes on. And if the therapy is not being used correctly, whether because the patient doesn't understand it, or because they can't get to the pharmacy in time, or the refills to the therapy don't happen on time, or they're trying to get them too early or whatever, we have yet another problem. So it's not so simple to talk about what quality and value are when we have so many different both clinical, behavioral, and other kinds of indicators that tend to cause inconvenience. Having said that, let me try and put some stakes in the ground to give some sort of idea of what we can use. On one level, when we talk about it, and we talk about quality and value and cost, we have to separate things out. So let me separate it out here. One is that there is a clinical outcome, and that clearly is something that's defined by healthcare professionals as to whether the clinical outcome has occurred. Number two, and by the way, that is like lowering your blood pressure or lowering your blood sugar or whatever it is. Number two is there behavioral things, and we certainly want to factor those in. Have there been roadblocks in it? In the very least, we can list them. And number three, from an appropriateness, inappropriateness, we have to take a look and say, what is the general standard of care? What is the gap between what is happening and the general standard of care, so that effectively, even in a population, the minimum standard of care is given and the population achieves that. This is a very broad kind of concept. I've tried to introduce some general ideas. In the coming time, we'll try and introduce even more. I look forward to speaking to you again. Have an outstanding day.